Hello, my name is Dr. Ray Milazzo of the Chiropractic Wellness Center, and today I'd like to talk to you about shoulder problems. It's very common in a chiropractic office that people will come in and their shoulders are hurting. As a matter of fact, sometimes people wait so long that they get to be where it's a frozen shoulder where they can't lift their shoulder anymore. And I've actually seen people 6 months to years where they've kind of gotten into that condition. So let's talk about the shoulder and what it entails and how we can keep it from going bad. What happens here in the shoulder, and it's a marvelous engineering feat here, is that we have shoulder muscles that hold our shoulder back into place, and that's called the rotator cuff muscles. And there's actually 4 of them. I'm not going to name them, but they're little muscles, and they keep your shoulder, your humerus back into the shoulder joint here. The problem is that as we look in the front of the body, we have these big muscles in the front called the pectoris, and they're a lot bigger than our little rotator cuff muscles. So especially as we develop our pectoral muscles, they tend to kind of pull the shoulder forward more into the joint, and the shoulder can go out of place very easily. Now, one of the things that's going to happen if the shoulder starts to move forward in the joint is you're going to start to irritate bursa joints, which are around the shoulder. You have bursas here, 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 and here, and they're very tender. What bursa joints do is they tend to lubricate the joints so that you can move them. They apply the fluid, kind of like the oil, the mechanism. It's kind of an oil machine. But if your shoulder starts moving forward because of that imbalance, you start to pinch on the anterior bursa, and that starts to what we call bursitis, and that's the beginning of your shoulder problems. So what we do in chiropractic is we make sure, first of all, that we teach you some exercises on how to strengthen these muscles. And that involves using bands or ropes or weights where you can kind of do this type of exercise where you're moving your arm out like that. And then also there's some exercises where you can start to stretch your pectoral muscle, where you kind of rotate away from the pec and you start stretching that. And then if your shoulder is out of place in chiropractic, it's very simple. We just come in here on the arm and we go bop, and we can put it back into place. Well, that's the 2-minute discussion on shoulder problems. I know there's a lot more involved. If you're having any problems with your shoulder or any other part of your body, you will want to consult a professional. If you have any questions about this blog or any others, you can contact me at drraymondmilazzo.com. I've enjoyed sharing this information with you this time, and we'll see you next time.